So this is Kenyans Media, and if you are new here, kindly subscribe, turn on notification bell so that you will be notified every time we post a new video. Please subscribe, share and comment. And today we are introducing a new segment that is health, and it is being brought to you by Greenview Nursing Home, Kericho. So I am privileged today to be having the General Manager, Greenview Nursing Home, that is Mr. Makori. So I want to welcome him so that he can say hi.
Hi, how are you?
Hi.
Thank you.
Karibu sana.
Asante sana. Thank you for having me.
And thank you for hosting us.
Yes.
We are really privileged to be having you guys on the show.
Asante.
So I want you to say hi to the viewers. And
hi viewers.
Yes. Uambie we ni nani?
Makori Jasper, General Manager.
Yes. So what do you do here?
Personally, I'm doing a lot of things for the facility. I'm in charge of the hour of operations under the leadership of various HODs.
Okay.
Yeah, I'm here to see the growth of the institution within this region.
Okay.
Yes.
So tell us a little bit about yourself.
Wow. I'm known to have several colors.
Yes.
But now to say this one, I've done this work for quite some time.
Yes.
Scaling down from KNH, Kenya International Hospital, that's where I got my experience from. Working in Eldoret in a number of hospitals. That is, started off with Real when I was so young.
Yes.
I went to Greenview, that's the facility I served for a very long time. I had a little stint with Top Aid Hostel for 1 year, 2 months. And then I came to Greenview now. I'm now starting my 4th year.
Okay.
Yeah, that's my background in terms of hospitals and health.
Yes. So thank you, Makori. So this is the new show, a brand new show of health. Maybe you tell them a little bit of what are we expecting in this show?
Now, what the viewers should expect. First of all, I would like now to envision the vision of my directors, why they came around. Will form the basis of why we came around here. If I can tell you briefly, my directors tried to do a study in the whole country where they can be able to invest in terms of healthcare. Now they singled out for Kericho. Why they singled out for Kericho, there was a serious need to have more facilities around here. For instance, in Greenview, the main flagship project is dialysis.
Yes.
In dialysis, initially, before they came around, we used to have, or there used to be, migration to Eldoret to seek their service. The data they had by then, they used to have 16 patients coming from Kericho. It means they're going to Eldoret twice a week. That one economically is expensive. Yeah. Now what the viewers should expect is how the coming of Greenview in the region, number one, and number two, how important is health when it's approached or looked into in earlier times.
Yes.
Yes, and number three, in overall, we are going to talk so much on our lifestyles. Yeah, in everything we're doing apart from the accidents, and even accidents are caused by lifestyles.
Maybe before we go to lifestyle and, you know, when you say health, it is something which is really broad, and some people might think health is just diseases.
Well, health is not just a disease. First of all, as a business practitioner, health is looked into several ways. When you say, I'm financially health, it means you've made a breakthrough in finances. When you say, I'm mentally health, it means, oh no, you are focused in life for the things you want to achieve. You are on that road, you are good. When you say, I'm healthy sound, it means you worked your life so well that now the diseases are not really attacking you. Yeah, so when we talk of health, should be looked into a broader way. Yes.
Okay.
Yeah.
So why is it important now that we are going to be in this program for a very long time? Why is it important that people should mind their health?
Well, one, why should people mind their health? The little understanding I have and the study I've done, poor management of health is the causative agent of poverty in any developing world and the developed world. If I can bring the little perspective, for example, the little I've heard of US.
Yes.
US is so much developed in a manner that it's a criminal or it's not okay, it's not good for you not to have a healthy card, health insurance. That's now in those developed countries. Why that? When you be attacked with any kind of health condition, you just walk to the nearest facility which will accept your healthy card, you get a service, you go. The importance of really understanding this one is when you understand the true spirit of taking care of your health in people to plan yourself. So poor management of health is the causative agent of poverty in anywhere. For example, take this one, I'm there at home, who has enjoyed his health up to the age of 50, 60 and all that. Then all of a sudden, the person is attacked, let me say for example, cancer. It's argued and witnessed that cancer is sometimes expensive to treat. This person does not have any health insurance. And auze gari, auze ng'ombe, auze miti. Wakati all these resources are offered, the man passes on. Poverty strikes in. Yes. So it's pretty important for anybody to really understand the importance of taking care of health, of his personal, his or her personal health. Is pretty important. Because as I was maneno, be assured that the next thing you're going to be poor. Let me give an example. Personally, I've had 1, 2, 3 issues with health. I remember my first surgery, it costed me close to 200,000. Fortunately, by then, I was working in a hospital. I had the NHIF health cover, and I had another extra insurance cover, which paid for me those pills. If I didn't have any of those ones, and bearing in mind by then I didn't have any good resources, nikuitisha michango nichangiwa already sana nitakuwa maskini. But now having that one already you are. Let me give you example too. Of late, the mode of movement, transport, they have most of it is motorbikes, the so-called boda. I could like now this person to listen to if you were to listen in this way. Amepanda pikipiki. Pikipiki imemwangusha. Kwa kupenda, kutopenda, lakini ushaanguka. We are looking at now the end result. You are having an injury. For example, you are having a head injury. The head injury, for the time I've understood, it cost, the least it will cost you is 350,000. This 350,000, and that one forms an emergency. That's a head injury. You must be seen by a neurosurgeon. And not the neurosurgeon, for example, in South Rift here. Truth be told, South Rift does not have a neurosurgeon. You'll be forced now to travel to Eldoret, nearest place. You get to Kisumu or get to Nakuru. But mainly in Eldoret, it's known to be the fact of neurosurgery out in this region because of the fact of doctors we have. And not the 350,000 I'm talking about. You go to a public facility. That's, for example, in Eldoret, you go to MTRH. No any other private facility. Now, if you go to a private facility, it will shoot by 100,000. Think it this way. This person does not have the cash. Does not have the insurance cover. What happens? Atauza shamba. Ukiuza shamba, poverty is striking. Yes, that's a myriad of examples. So when you're talking about the understanding of your health, it's so much good. Let me give you example number 3. Let us talk about cancer. Personally, I'm not a practitioner, a medical practitioner. But I'm told, if you understand cancer at informative stages, you may not even use any medical drug. You'll be on nutritional health. You know what to eat and what not to eat.
Exactly.
And you'll be okay. But now, if you take your time, you have not gone for the various tests in time, it's discovered very late. It's having a diverse effect. And why I collect people to understand health? Kuna ile kitu wanasema wasimu sokoni ana uchungu. Mwenye na uchungu ni chami yake. So for a person, I want him or her to understand when one decides to be careless with his life, health-wise, having the don't care attitude, the most people affected is the immediate family, the surrounding.
Yes.
We like now for my more than 10 years in practice, I've seen several cases coming to hospitals. A person comes, anataka apembelezwe kudunga shindano, anapembelezwa afanye na watu anapembeleza ni family, ni familia. The person does not have the pain. So when one becomes careless with his health, the effect goes to the immediate family. Yeah, so what you're trying to tell us, Makuru, is that prevention, actually learning about how to prevent some kind of diseases and some kind of health issues, is by starting understanding how to prevent those diseases. Sure. And when you talk about prevention, it's good when one knows the do's and the don'ts. Yes, thank you. Particularly when talk of, let's talk about drinking water. I've heard people talk about it severally. Personally, I go to SDA Church. With the SDA Church teaches more of drinking water and nutrition. So much. Sometimes people tend to assume about it. But I can tell you for free that when your body starts now to ask for water, already your health is being affected. Yes. Okay. Yeah. So there's this thing about lifestyle, and there's a huge relationship between lifestyle and health. Maybe you can take us through briefly about lifestyle and health. You see, health can't go minus lifestyle. It starts from how you eat, how you sleep, whom you work with, who you share with, how you conduct yourself at the workplace. Yes. So when it comes down to your health is directly affected on the decisions you make in every minute of your life. Yes. For instance, think a scenario. It's argued that you're supposed to sleep at least 8 hours. Yeah. You go to bed late. And you wake up early. For example, you've gone to bed at 2 a.m. You're supposed to be in office by 7. 8, yeah. 7, 8 there. So it means if you're going to bed at 2 a.m., you're supposed to be up by 6. So that you can get ready for work. You can get ready for work. And I'm talking for those people who are outside the city. Yeah. If you're living in Nairobi, now like now the Nairobi city, Kisumu city and Mombasa, and by extension Eldoret of late and the Kisii, the towns I know. I cannot talk about towns which I don't know. Like now in Nairobi, you're staying at Kitengela. You want to be in office at the CBD at 8, yes. And you slept at 1. Yeah. So try to calculate. Already you have affected your health. Remember now you are not going to be very productive the following day in office. One, you're going to start quarreling on traffic. Yes. Because you've woken up late, you want to beat the traffic. Yes. That's not health. Already you've affected your mind. Number 2, you'll get to job. Already you get to job either on time or late. So you can't pick your day. Once you've not picked your day, destroying. Your wrong decisions are going to affect your immediate colleagues. Yes. Then your personal decisions, your own lifestyle affects your personal health and affects the health of your closest person, your family, your colleagues at work, and wherever. So it's pretty important for anybody to really understand the importance of understanding this lifestyle, the proper way of understanding a lifestyle. Okay, to go to extreme, a person is careless with his relationship life. That's a lifestyle. He goes there, picks diseases, brings them to the home. He has affected the person. So it's very important when the person understands lifestyle yake ikona direct effect to the health. And now this effect it has it to the persona and not the next person. And I'd like for them to understand the most affected person mostly is not you. Yes. Your next of kin. For example, I'm a family person. My poor decisions, my poor lifestyle, the first person to affect is my family, my wife, my children, then it gets to my parents and my siblings.
Yeah.
That one should be put into consideration. Yeah.
Thank you so much, Makori. I know as we go ahead with the program, there are so many areas we are going to touch, most especially when it comes to prevention of the diseases and minding your health mostly.
Yeah.
So as we wind up the show, I know we still have time with you as we go ahead. What are some of the important areas everybody anyone outside there should mind the most when it comes to health?
No, one of the things on my own experience, thought process. Yes, mind of your thought process. Yes, what you mainly you think. We are the product of our thinking. Yes, that's one thing they should mind of. Number two, they should mind of their immediate surrounding.
Yes.
They should not be selfish. They should be sound of their immediate surrounding. And number three, let anyone know that sometimes silence is taken to be rude, but it's more curable than giving immediate answers, which are sometimes can be inappropriate, and its immediate effect could be negative. Yes. Yeah.
True. So thank you so much, Mr. Makori, and thank you for hosting us.
No.
Maybe I want you to officially welcome the audience to join us every Thursday, every week, every Thursday.
Oh, that's a huge task.
Yes.
Let me say this. I would like to welcome the viewers for the program to really benefit from it.
Yeah.
As one of the leaders of the program, this is what I love to say.
Yeah.
The program is intending to make you health. That's the physical health, mental health, financial health, relationship health, and all those.
Yes.
Mainly the discussion will be based widely, not limited to single kind of conditions. Yes, we may be discussing, for example, about pneumonia, we may discuss about HIV/AIDS, we may discuss about cancer, we may discuss about pain, and all those.
Yes.
But mainly it's looked at to inform the general public what they should do in every stage of any happening in their lives, personal life, and their life surrounding them.
Thank you.
So karibuni sana.
Yes. Actually, I don't have anything else to say because amemaliza yote. So thank you so much, Greenview Nursing Home, Kericho, for hosting us and for bringing us this program. My name is Cynthia Cherer, and you are with Mr. Makori, who is the General Manager, Greenview Nursing Home. Till next time, bye-bye.